In this short video, we're going to demonstrate Setu Bandha Sarvangasana, otherwise known as bridge posture. So bridge posture is traditionally found within a finishing sequence, as it's an inversion posture and it's really nice for helping to relax the client, relax the mind and to replenish the body, ready for moving into Shavasana. But it's a hip opening posture. So it opens up the hip flexor region. It also helps to open up the chest and the anterior deltoids. And it's a posture that's used to help to develop the client ready for the high bridge. And the high bridge is traditionally known as that crab posture. But it's also great, as long with opening up the hip flexors, opening up the chest and the front of the shoulders, it's also great for helping to develop strength within the glutes, along with the hamstrings as well, which in back pain sufferers can quite often be a little bit weak. So it's strengthening the erector spinae group, it's strengthening gluteus maximus and the hamstrings, but it's opening up the hip flexors and the chest and the shoulders. So a couple of points that we need to be aware of before our client starts, and that's their setup position. So you want your client to be in a position where their feet are hip distance apart. And just check the positioning of the feet, because quite often when people bring the feet back, they point the feet out to the side slightly. So just check their position and make sure that their feet are hip distance apart and those toes are pointing forwards. Then be aware of what's happening to the knees. Are they naturally dropping those knees in, or are their knees naturally dropping out to the side? So ideally, we want these knees in line with the hips. We want the back flat on the floor, and it's quite nice to get the client to tuck the chin slightly into the chest so they can lengthen the back of the neck as they're lying down. Because sometimes when people lay down, they might lie with their chin up towards the ceiling. So just prompt your client just to tuck that chin in towards the chest slightly so they're now lengthening at the back of the neck. Client's got the bandhas engaged. Okay, so Mula bandha is engaged, Uddiyana bandha is engaged. And those arms can then lay down to the side of the body. And the palms can face flat down onto the mat, as sometimes clients might need a little bit of assistance with them lifting themselves up against gravity. So we're going to roll up into the bridge posture, because if we roll up into the bridge rather than press up into the bridge, it's quite a nice mobilization for the vertebrae in the back. So what we're going to do first of all is we're going to instruct the client to ground the feet down into the mat. That will help to engage the legs. We're lengthening the knees towards the wall in front of them. And then as they do that, they're going to roll the tailbone up towards the ceiling first, then roll up through the lower back, then roll up through the mid back and the rib cage, and then keep rolling up into that bridge till they're up towards the top of the shoulders. So we want them to try to lift up as much as they can. They can either use those hands to press down into the mat lightly, or they can take the hands and place them into the small of the back, just to support the bottom slightly. Another positioning, so they can support the bottom with the hands. Another positioning for the hands is to interlock the hands and stretch those clasped hands towards the feet, as that helps to open up the front of the shoulders and the chest a little bit more. So just to recap that, Katie's got her hands clasped now. She's stretching her clasped hands towards her ankles. Or she could take the hands, place them on the bottom to provide a little bit more of a lift, which will help to open a bit more at the front of the hips. Or she can press the hands down into the mat. Now, whilst Katie is up, what's happened is that knees have gone out slightly in order to help to lift her up. So we would just need to correct that, ask the client to bring those knees back in line with the hips, or what we could do, because sometimes people might be a little bit weaker in the adductors and stronger in the abductors, so the knees are naturally splaying out to the side. So in those instances, what we can do is we can take 2 blocks in between the knees and ask the client to squeeze those knees into the blocks as they continue to lift up in that bridge posture. And then that way we know they're in that nice alignment. Okay. Then after 3 to 5 breaths, I'm just going to take those, after 3 to 5 breaths, then when your client's ready, they're going to roll down again. So starting with the top, rolling down through the rib cage, through the lower back, through the pelvis, and then back into that neutral position. And in between those repetitions, the client needs to have some rest breaths. So they can either have the rest breaths here, or they can bring those knees into the chest and go into that ball stretch for the rest breath. And just gently lay there for 2, 3, or even 5 breaths until they're ready to lift back up into their second bridge posture. Traditionally, we would do about 3 repetitions of bridge posture. So we're just going to recap that. So Katie's got her feet hip distance apart. She's got her heels back towards the bottom to a position that's comfortable. Knees roughly in line with the ankles. Then knees also in line with the hips, and her feet are facing forward. Then she's going to take a deep breath in through the nose, using that Ujjayi breath if it's comfortable for her. And then as she breathes out, she's going to roll up into that bridge posture. So she's lifting tailbone first, or coccyx first, lifting up through the lower back, mid back, and then all the way up to the top of the shoulders, or as high as her body is allowing her to go today. Opening up front of the hips, or hip flexor region, opening up the chest and the front of the shoulders, and hands either pressing down into the mat, onto the glutes, or interlocked and stretching towards the ankles. Then after 3 to 5 repetitions, she's now going to roll back down, or 3 to 5 breaths, I should say. She's going to roll all the way back down to the mat and into her rest posture. So that's an active variation of bridge posture. And we always want to do at least 1 active bridge postures in our classes at the end for that finishing sequence, because we're working the body in this posture. And we're working it quite hard because, again, we're lifting up against gravity. But we can also do a restorative bridge posture. So it might be that you've done 1 or 2 active bridge postures before you go into this restorative one. And this is really nice to do before moving into Shavasana. So in the restorative posture, we're resting into the blocks. So we're still actively lifting up into the bridge. So Katie, again, is in her alignment. She's going to roll up into her bridge. And then when she's up in that high phase, she might need to lift up onto her tiptoes, and these blocks are just going to come into that sacrum area. So allow your client to pop the blocks in, and so that their sacrum, or the top of the glutes, is resting onto the blocks. Now Katie, in this position, Katie can now relax her legs. So she's still getting that nice opening at the front of the hips, but she's relaxing her legs. So she's not having to work the glutes, work the hamstrings to stay up in this position. And she can also relax the upper body. She can either keep the arms down to the side, but sometimes it's quite nice to then stretch those arms behind the head if that feels comfortable. So now she's relaxing that back chain, but she's opening up this front chain by lengthening those arms, opening up the front of the chest and the hips in this restorative bridge. And again, Katie could stay here for about 5 breaths or even longer if the client is comfortable in this position. And then to move out of this bridge posture, the client would then bring those arms forward. And then she might need to lift up onto the tiptoes again, just to remove those blocks, to create that space. And then Katie would roll back down into that rest position. So that was our bridge posture, opening up front of the body and strengthening the back of the body.